Good afternoon. I'd like to introduce you to my good friend Medina Kakiyama. In 2006, Medina was running an HIV prevention program in Uganda called Stay Alive. It was taught in primary schools and targeted children between the ages of 9 and 14. As part of her regular program evaluation, Medina talked with girls about how this program was impacting their practical everyday lives. The girls reported that they loved the program, but there was an additional piece of feedback that surprised Medina. The girls began telling her that they were skipping school. Now, a study conducted later showed that almost 20% of these girls reported missing. The reasons for missing school were not the ones you would typically think, like, oh, I didn't have enough money for school fees, or I had to work in the field or the market, or even I had to stay home to take care of a sick family member. Now, you need to know that the early 2000s saw several African nations introduce free primary education. This was in direct response to the United Nations Millennium Development Goals number 2 and 3, and indirectly in response to number 4 and 5. Education, especially of a girl, is widely regarded as the best investment that a developing country can make. It's associated with better health outcomes and lower maternal and child mortality rates. So why would African girls be skipping out on this incredible opportunity? The answer? Take a look at this.
Hi, I'm Emily Brown. I'm 16 years old and a sophomore in high school. I want to be a doctor and hope to go to Johns Hopkins University, and I've never missed a day of school just because I am a girl. Last summer, I got to go to Kenya and talk to girls about what their life is like. Lots of things were similar, but there was one big difference. They don't have maturation programs, and most of them haven't learned about puberty or menstruation. It is culturally inappropriate for parents to talk to their children about such things, so girls are very unprepared when they start their period. Some girls think they are sick or even dying. I thought it would be interesting to compare how girls in Africa deal with their menstruation as opposed to some of my friends in America. How old were you when you started your period?
I was 12 years old when I started.
Yes, 13.
12?
Yes.
I think I was 12 area? 12. Yeah, I was 14. I think you were a year younger than me. Okay, I was 13.
14? What about you? And you?
What do you use for supplies?
Just pads that my mom gives me.
I use tampons.
Tampons and pads.
Cloths?
Tissues.
Yeah.
Then after that you wash.
Yeah.
That some people are lacking sanitary pads.
Some people are lacking sanitary pads?
Do you have some?
How do you get the supplies?
Go to the store and buy it.
You do not buy your own tampons.
My mother buys them. I'm just saying, generally, you go to the store and you buy them.
Do you know how much they cost?
$20 for a big bucket of tampons.
Do you know how much they cost?
No.
It cost about $3, I guess. I don't know.
Do you know how much pads cost? How much?
If an African girl needs 1/30 of her family's monthly income for sanitary supplies, that's equivalent to the average American girl spending $116 per month on pads. And what if there are 2 or 3 girls in the family?
Do you ask your mother or your father for money?
I'm usually scared of asking from my father because my mother is dead.
How do you manage your period at school?
I change them every third period in school, and friends and teachers are okay with it. I
Yeah.
get excused from class.
If it's started you at school, you can tell your friend to help you learn with sweater. To go and know what you are going to do with that sweater.
Yeah. Have you ever missed school because of your period?
No. I haven't.
You do?
They feel shy.
Yeah.
Even when they don't have money for buying sanitary pads, they put some bottle pills, and that you can also stay with it for 30 minutes. So you go to the toilet
is, because of extreme poverty, many African girls don't have the resources to buy sanitary supplies and end up missing up to 5 days of school a month. Sooner or later, they fall far enough behind that they end up dropping out of school. I know that if I missed a week of school every month, I wouldn't be going to college.
Now, my friend Medina had dealt with this issue personally, and several years ago, as a graduate student in public health, Medina approached me and a colleague of mine and asked us to please help her solve this problem. So we thought we could do this. This will be easy. We'll just call up Procter & Gamble and ask them to donate pads. And when we did a little research, we found that, in fact, Procter & Gamble was aware of the problem and had already launched their Protecting Futures program, wherein a portion of the proceeds of sales of Always pads goes to providing pads for girls in Africa. But we began to wonder, is providing disposable pads really the solution? If your only option for disposal is down a pit latrine or burning, what will the eventual impact be on the environment? And would the high cost of a disposable product affect how often a girl changes her pad? The tendency would be to make them last longer, not change them as frequently. And wouldn't this in turn cause serious health outcomes such as urinary tract infections and pelvic inflammatory disease? So what does any good graduate student do that has questions they need answered? They do a study, and that's what we did. We assessed the knowledge, attitudes, and behaviors of 550 African girls concerning menstruation and the barriers to attending school. We found that, yes, girls do need pads, but it is not enough to just give a girl a pad. She needs health education, and not just the facts. Although 72% of the girls we assessed said that they had been taught about the reproductive system, only 45% could tell us the purpose of the uterus, and only 34% knew the reason for menstruation. There were also all kinds of cultural and social barriers which were contributing to absenteeism. Things like high levels of teasing by boys, fear of soiling precious uniforms due to leakage, and even pressure from family members to marry early. My friend likes to say, if we want complete change, we must quit hacking at the leaves of attitude and behavior and get to work on the root from which these attitudes and behaviors flow. Girls need comprehensive health education that covers social, emotional, and spiritual health, as well as the physical ins and outs of growing up. So Medina suggested that we put sewing machines in schools and teach girls to sew, which would give them a marketable skill, and then have them sew reusable sanitary pads, which would ensure that lack of supplies was not one of the reasons that girls were missing school. Coupled with this pad sewing program would be a health education package. Medina asked us to write some simple lessons that could be taught to children. Well, health education is my background, so I thought, this is going to be easy. Now, I'd been to Africa enough to know that what we consider best practices here in America doesn't always translate well to other cultures. But I thought, we have to start somewhere. So, okay, 5th grade maturation night. You know, you remember where you meet in the gym or the library with your mom or dad and you watch a slightly uncomfortable movie about growing up. And, you know, there's always a brave kid or two that raises their hand with a burning question like, what is a gigolo? Anyway, I thought, we have to start somewhere. We'll be simple. We'll start with something like 5th grade maturation. So we donated sewing machines and fabric, and we wrote some simple lessons, and away we went. Now, feedback is the key to refinement of any product, and we had 2 products. We had a reusable pad and a health education package. We began a process of modification and evaluation of these products, and along the way, this process took 5 years, we learned this was not going to be easy. But we learned some valuable lessons that I hope will help you in whatever pursuits you are undertaking. Lesson number 1. People come to us all the time and say, we want to help. We want to sew pads and ship them off to Africa or India or Guatemala or wherever. What's best? What works best? Do you have a pattern? Well, the answer is yes, we do have a pattern. I'd like to show you some of the prototypes that we used in Africa and the feedback that we got, which helped us to get to this pattern. This first one was made of cotton and had an opening at the back where you could insert toweling for absorbency. It also had nice wings that wrapped around the crotch of underwear and was secured with Velcro. The feedback we got was too bulky, too expensive to reproduce, and the Velcro was kind of uncomfortable. Also, what do you do about girls who don't have underwear? Because believe it or not, in Africa, there are many who don't. So then we found these versions, which are not dependent on underwear. The one on the left was developed by the UN. And although easy to make, it's, as you might guess, a little hard to explain how to use. So basically, the string is threaded through 2 loops on either end of the pad to create leg openings, and then the string's wrapped around the waist and tied. The one on the right is kind of what I imagine our great-grandmothers might have worn, and girls, they really don't like this version. The elastic waistband is hard to adjust, and they frankly just want something with wings. It's much more like the Always brand pads that they see advertised everywhere. Go advertising. The next version is what we call the Mercedes-Benz. It was made of water-shedding fabric. It had fancy snaps and nice, soft flannel pads that slipped in and out for easy changing. Although girls loved the design, we learned they don't want white. As you can imagine in Africa, when the water you're using for washing is brown and muddy, white fabric just becomes dingy very quickly. And the snaps, if they broke, were really hard to replace. Bottom line, if your Mercedes-Benz breaks down in Africa, you'll have a hard time finding replacement parts. Next version was enthusiastically received. They loved the brighter colors. Pattern was great, design worked, but now the information was, because of some of the issues with HIV and menstruation, every girl in a family needed to have her own set of different colored pads so that there would be no mix-up and sharing. Latest feedback that we're dealing with is this issue of leakage. So we're looking at trying to find locally produced, affordable, waterproof fabrics that can be inserted in the lining of the pad. But the greatest realization that we had through this process is that the best pattern is to actually have people sew them locally. They're the experts. They know how to adjust that pad to fit their needs, their resources, and their culture. Lesson number 2. There's a running debate in my household about which is better, an In-N-Out burger or Five Guys. Personally, I love an In-N-Out burger. It's fresh, it's light, tastes the same every time, delicious. But some of my family subscribe to the Five Guys method. Make a big juicy burger, let people modify it, put whatever they want on it, dress it to their own taste. We realize as we are trying to scale up our health education package to global populations that we need to give them permission to modify the burger. This Five Guys approach has created a very collaborative effect, and also the realization that the path to solution really never ends. There is no such thing as the best burger. You just modify and modify and modify. Lesson number 3, historically in Africa, families lived in tribes. They intermarried, they lived close together. The responsibility for teaching a girl about growing up, and how to become a woman, menstruation, sex and marriage, fell to the father's sister. These aunties relished this role, but with families splintering because of poverty-driven migration from rural to urban settings, and because of the high impact of HIV, the responsibility to prepare a girl for the onset of menstruation is falling more and more to teachers. And sadly, even the most educated of teachers often don't have correct reproductive information. Studies show that although girls are getting reproductive information from a variety of sources, they want to learn about growing up from their mothers. There is just no substitute for good old mom. Mothers everywhere want the same thing for their children, that they grow up to be healthy and happy. If you think about it, mothers are the largest group of health practitioners in the world. If you teach a mother, you may save a nation. Last fall, while in Kenya, my daughter and I had the chance to have boys and girls write on pieces of paper questions they had for us about growing up and health.
Some girls would ask questions like, if I don't start my period before I'm 16, is there something wrong with me? Or, why is abortion illegal?
What was insightful and compelling to me, though, were some of the questions that the boys were asking. Besides wanting to know if we were personal friends of Barack Obama, I don't know, are you? No. They wanted to know things like, how can I avoid peer pressure? And why, when boys are growing up, won't they listen to their mothers? Well, I have a 13-year-old son, and I was wondering the same thing. The most interesting question that I found, I don't know if you can read this, was from one 14-year-old boy. He says, I have a girlfriend, and she is giving me a lot of stress. What can I do? I wanted to say, friend, I think that's the universal question of all men. Clearly, we can't forget about boys. Their need to understand the natural process of growing up and how to become respectful, responsible young men is tremendous. In fact, as we have gone through this process, we have come to realize that our time and resources are best spent on health prevention in the form of education. So we have actually delegated pad making to partners who are better suited to that area, and we've turned our attention to the creation of health education materials tailored to developing countries.
As my mom and I have watched humanitarian organizations come to the aid of victims of natural disasters, we've often turned to each other and said,
They need pads, not toothbrushes.
Not to undermine the importance of brushing your teeth, but we found when showing girls pad kits, which included pairs of underwear, the reusable pads, soap, a washcloth, and fingernail clippers, we found that items were disappearing. It was never the fingernail clippers, rarely the soap, but mostly the pads and underwear. We began to realize that these items were so desirable that people were willing to steal them right in front of our eyes. There must be a hierarchy of needs, which would greatly shape our recommendations for the future. We find this to be an interesting hypothesis and plan to test it as we travel to Africa this summer for research.
This research will be another piece of feedback which will help us to create another iteration on our path to helping girls stay in school so that they can reap all of the benefits, health and otherwise, of an education. Thank you.